There are two main types of diabetes, type 1 and type 2. Both types of diabetes are chronic diseases that affect the way your body regulates blood sugar, or glucose. Glucose is the fuel that feeds your body's cells, but to enter your cells it needs a key. Insulin is that key. People with type 1 diabetes don't produce insulin. You can think of it as not having a key. People with type 2 diabetes don't respond to insulin as well as they should, and later in the disease often don't make enough insulin. You can think of this as having a broken key. Both types of diabetes can lead to chronically high blood sugar levels. That increases the risk of diabetes complications. What are the symptoms of diabetes? Both types of diabetes, if not controlled, share many similar symptoms, including frequent urination, feeling very thirsty and drinking a lot, feeling very hungry, feeling very fatigued, blurry vision, cuts or sores that don't heal properly. People with type 1 diabetes may also experience irritability and mood changes, and unintentionally lose weight. People with type 2 diabetes may also have numbness and tingling in their hands or feet. Although many of the symptoms of type 1 and type 2 diabetes are similar, they present in very different ways. Many people with type 2 diabetes won't have symptoms for many years. Then often the symptoms of type 2 diabetes develop slowly over the course of time. Some people with type 2 diabetes have no symptoms at all and don't discover their condition until complications develop. The symptoms of type 1 diabetes develop fast, typically over the course of several weeks. Type 1 diabetes, which was once known as juvenile diabetes, usually develops in childhood or adolescence. But it's possible to get type 1 diabetes later in life. What causes diabetes? Type 1 and type 2 diabetes may have similar names, but they are different diseases with unique causes. Causes of type 1 diabetes. The body's immune system is responsible for fighting off foreign invaders, like harmful viruses and bacteria. In people with type 1 diabetes, the immune system mistakes the body's own healthy cells for foreign invaders. It may have something to do with genetic and environmental factors, like exposure to viruses. Research is ongoing. Causes of type 2 diabetes. People with type 2 diabetes have insulin resistance. The body still produces insulin, but it's unable to use it effectively. Researchers aren't sure why some people become insulin resistant and others don't, but several lifestyle factors may contribute, including excess weight and inactivity. Other genetic and environmental factors may also contribute. When you develop type 2 diabetes, your pancreas will try to compensate by producing more insulin. Because your body is unable to effectively use insulin, glucose will accumulate in your bloodstream. How are type 1 and type 2 diabetes treated? There's no cure for type 1 diabetes. People with type 1 diabetes don't produce insulin, so it must be regularly injected into your body. Some people take injections into the soft tissue, such as the stomach, arm, or buttocks, several times per day. Other people use insulin pumps. Insulin pumps supply a steady amount of insulin into the body through a small tube. Blood sugar testing is an essential part of managing type 1 diabetes, because levels can go up and down quickly. Type 2 diabetes can be controlled and even reversed with diet and exercise alone, but many people need extra support. If lifestyle changes aren't enough, your doctor may prescribe medications that help your body use insulin more effectively. Monitoring your blood sugar is an essential part of diabetes management because it's the only way to know if you're meeting your target levels. Your doctor may recommend testing your blood sugar occasionally or more frequently. If your blood sugars are high, your doctor may recommend insulin injections. With careful monitoring, you can get your blood sugar levels back to normal and prevent the development of serious complications. Thank you for watching.